can you mix and match ACTIVA BioACTIVE with other RMGIs and composites?
That's a question that I get all the time. And I think the short answer to that is yes. Because when you look at the history of sandwich technique, which is glass ionomers followed by RMGIs and stacking composite on the top, because those first two materials don't have the physical properties to properly replace enamel and absorb occlusal forces without tremendous wear. That's where, if you look back from John McLean and Graham Milicic and some of these other people that have talked about sandwich technique for years, that's where that all came about. They used glass ionomers as dentin replacements, and they used composites as the enamel replacement. So that was mixing and matching. That's what sandwich technique is. Now, advance that to today's world and comparing RMGIs and GIs with ACTIVA. And I think that's a big question to get too. I mean, RMGIs, I think it's really hard to make a comparison because the more resin in the RMGIs makes the physical properties a little bit better, but it also hinders fluoride release initially and over time. And GIs have great fluoride release, but they don't do so good as far as the physical properties and wear. So that ACTIVA really, to me, has changed the face of sandwich technique. And using ACTIVA, again, bioactive as the dentin or the bulk fill, and then using a composite on the top of it, certainly makes more sense to me than using a conventional glass ionomer and a composite on the top of it. But the short answer, again, after that long discussion is yes, you can mix and match with other RMGI composites if you so choose.
Totally agree to that, yeah. If a dentist is very aesthetic conscious, like he wants to give that wow effect on the occlusal surface or maybe even an anterior restoration, please go ahead. And putting ACTIVA is definitely going to stop the micro leakage and those stains coming back. And also, all in all, yes, you can use, depending.
And plus help the dentin bond. Plus help the dentin bond.
Yeah, yeah. So all in all, it's a completely win-win situation. However way you want to use ACTIVA, up to you. With other materials, solo, anyhow. It's a winning streak for the patient's oral health. That is our first primary concern.
Absolutely.